Latest guidelines on organ donation. Over the past 50 years, the transplantation of human organs, tissues and cells has become a worldwide practice which has extended and greatly enhanced the quality of hundreds of thousands of lives. Continuous improvements in medical technology, particularly in relation to organ and tissue rejection, have led to an increase in the demand for organs and tissues. Cells, tissues and organs may be removed from the bodies of deceased persons for the purpose of transplantation if any consent required by law is obtained, and there is no reason to believe that the deceased person objected to such removal. Physicians determining that a potential donor has died should not be directly involved in cell, tissue or organ removal from the donor or subsequent transplantation procedures, nor should they be responsible for the care of any intended recipient. Donation from deceased persons should be developed to its maximum therapeutic potential, but adult living persons may donate organs as permitted by domestic regulations, if they are genetically, legally or emotionally related to their recipients. The donor's informed and voluntary consent must be obtained, their professional care of donors is ensured and follow-up must be well organized, and their selection criteria for donors should be scrupulously applied and monitored. Live donors should be informed of the probable risks, benefits and consequences of donation. They should be acting willingly, free of any undue influence or coercion. No cells, tissues or organs should be removed from the body of a living minor for the purpose of transplantation other than narrow exceptions allowed under national law. Specific measures should be in place to protect the minor and, wherever possible, the minor's assent should be obtained before donation. The allocation of organs, cells and tissues should be guided by clinical criteria and ethical norms, not financial or other considerations. Allocation rules, defined by appropriately constituted committees, should be equitable, externally justified, and transparent. High-quality, safe and efficacious procedures are essential for donors and recipients. The long-term outcomes of cell, tissue and organ donation and transplantation should be assessed for the living donor as well as the recipient. The level of safety, efficacy and quality of human cells, tissues and organs for transplantation must be maintained and optimized on an ongoing basis. This requires implementation of quality systems including traceability and vigilance, with adverse events and reactions reported, both nationally and for exported human products. The organization and execution of donation and transplantation activities, as well as their clinical results, must be transparent and open to scrutiny, while ensuring that the personal anonymity and privacy of donors and recipients are always protected. Donors with the following should not be accepted for organ donation: positive PCR testing for COVID-19. Donor exposed to a patient with confirmed or suspected COVID-19 within 14 days. Fever and/or respiratory symptoms, unless severe acute respiratory syndrome coronavirus 2. Unexplained respiratory failure leading to death. Some national guidelines recommend routine testing of donors for severe acute respiratory syndrome coronavirus 2. If transplantation is required as a life-saving procedure, it can be conducted with appropriate assessment of infection and donor and recipient. As with potential deceased donors, but more easily applied in the living donor setting, knowledge of local epidemiology is crucial. Donors and recipients who have recently been exposed to known clusters should be deferred. One approach that has been adopted is to have both donor and recipient practice strict social distancing, which include a 2-week stay-home period, with a PCR test for both at the end of the period, prior to transplant. In countries with widespread community transmission, temporary suspension of the living donor kidney and liver transplant programs should be considered when donation can safely be deferred to a later date. The shortage of available organs has not only prompted many countries to develop procedures and systems to increase supply but has also stimulated commercial traffic in human organs, particularly from living donors who are unrelated to recipients. Purchasing, or offering to purchase, cells, tissues or organs for transplantation, or sale by living persons or by the next of kin for deceased persons, should be banned.